Hi, my name is Stephanie Armfield. I'll be completing the head-to-toe assessment for Advanced Health Assessment course at Maryville University. So this is my patient. When she arrived, I had her change into her gown, empty her bladder, and I obtained her vital signs, height, and weight. So for the first part of the assessment, I'll just do a general inspection. Her hygiene is appropriate. She's dressed appropriately. And then now I'll assess for her head and face. So the skin on her face is clear, it's dry, it's normal. Her hair is evenly distributed. There doesn't look like there's any hair loss. Now I'll palpate from front to back. There's no lesions, masses, or anything abnormal. And looking at her facial features, her eyes are symmetric. They're normal in shape and size. There's no periorbital edema. There's no redness. Her eyelids, there's no signs of any drooping. Her eyebrows have even amount of hair and they extend past her eyes. Her eyelashes curve out away from the globe. Let's see. And now I'll have you wrinkle your forehead. Open your eyes real wide. Stick out your tongue. And puff out your cheeks. Alright, she had normal facial movements. And now I will test for her TMJ. So, clench your teeth. You can open your jaw and close it. Alright, there's no popping, clicking. Did you have any pain with doing that? Alright. Let's see. Now I will assess for her sinuses, her frontal and maxillary. Is there any pain?
No.
Alright. And back to her eyes. Her conjunctiva is white. There's no redness. Assessing her lacrimal apparatus. Alright. And that is normal. Now I will test for light sensation. So if you could close your eyes. Tell me when you feel this.
Mm-hmm. Okay. Okay. Okay.
And her sensation was intact. I've already assessed for her eyebrows, and they're, like I said, they're extend past the eyes, and they have normal amounts of hair. Can you raise them? All right. I've already palpated her lacrimal apparatus, and at this time, when she came in, I tested her vision using the Romberg and the Snellen test. Now I'll be checking her vision, her pupil response first. All right, look straight ahead. Her pupils are reactive to light, and they're equal. They're about a 2+. Now I'll be assessing her red reflex. All right, look straight ahead. Her red reflex is intact as well. Now I'll have you repeat what I'm doing. So we cover your right hand with your right eye. And switch. The left hand over the left eye. Perfect. You did that appropriately. Now I'll be testing her 6 cardinal fields of gaze. Alright, so I want you to track my pen with your eyes, but don't move your head. And tell me when you see it.
See it. See it. See it. See it. See it. See it.
Alright. And now I want you to trace, making sure she can move her eyes. Okay. And now I'll test for accommodation. Okay. And her eyes accommodated appropriately. Alright, now I'll be assessing her ears. Your ears are symmetric, they're normal in size. Do you have any pain when I pull up on your pinna?
No.
Alright. And palpating her auricles. So I'll be assessing her hearing with the whisper test, which assesses for cranial nerve 8. So I'll stand 5 feet away. Alright, repeat after me.
Banana smoothie.
And one more time.
Chocolate chip cookie.
Which she was able to repeat what I said appropriately. Now I'll be testing for her hearing using the Weber and the Renee test. Alright. I'll need you to tell me if you can hear sounds equally on both sides.
Equal.
And then I'll be testing the air and bone conduction. Tell me when you quit hearing it.
Now. Now.
Okay. And the air conduction was twice as long as the bone conduction, which is normal. Now I'll be assessing her tympanic membrane. Her tympanic membrane is pearly gray. Her internal ear bones are normal. There's no redness, there's no lesions, there's no foreign bodies, and normal amounts of cerumen. Alright, and I'll assess her other ear as well. Again, her tympanic membrane is pearly gray, there's no foreign bodies, normal amounts of cerumen, and there's no lesions or redness. Now I'll go back to her nose. It's in the center of her face. There's no swelling. I'll assess the patency now. Can you occlude one nostril and take a deep breath or inhale and switch sides? She did that appropriately. I'll look inside her nares. Okay. Alright, there's no occlusions. There's no abnormal redness. There's no drainage, and her septum is intact. It is not deviated. I'll be assessing her mouth now. Alright. Let's see. I'll use this light. Or I can use this light. Okay. Say ah.
Ah.
Alright. There's no dental caries. There's 32 teeth. None are missing. Can you stick out your tongue? Okay. Her tonsils are not touching. There's 2+. Her hard and soft palates are intact. I'll be assessing her gag reflex now. And her uvula is midline. There's no obvious nodules. So I'm going to test her gag reflex. Her gag reflex is intact. Her tongue didn't have any craters. It was red and moist. Her lips there's no lesions, cracking. They're moist as well. And there's no signs of any bleeding amongst her lips or gums. Now I'll be assessing her neck. So I'll be assessing the thyroid gland. First, I'm going to feel for any nodules. I'll have you swallow. Alright, that felt normal. I didn't feel any problems there. It's normal size, symmetrical, and like I said, it has normal contour with swallowing. I'm going to have you lean forward a little bit. There's no jugular venous distension present. And then I'm going to perform passive range of motion. So I'm going to have you turn towards my hand against resistance. Okay. And this way. All right. And that was intact. I'll be assessing her carotid pulses. Take a listen. Her carotid pulses were intact. There was not any signs of brewery with auscultation. Let's see, and now I'll be assessing for her lymph nodes. I'll be testing her supra-auricular. Do you have any pain?
Nope.
Her submandibular. The posterior cervical in her neck. Occipital in the back. Any pain?
Nope.
Alright, I don't feel any lymph nodes, and I'll test the axillary as well. Okay. Her lymph nodes are not palpated as either. Now I'll be assessing her upper extremities. There's no edema, bruising noted. Can you shrug your shoulders? Okay, that's normal. Let's see your hands. She's not missing any fingers. Her nails are intact, no breakage. Let's see. Can you push up? Push down. Okay. Let's see. When she walked in, she was carrying her arms at a 15-degree angle, which is normal. I'm going to test her radial pulses and her brachial. They're intact, 2+, and they're equal. Now I'll be assessing her back and her posterior chest. All right. I'm going to have you turn. We're going to move the chair just a little bit. All right. So I'm going to test for expansion first. So deep breath. And then I'll have her just sit here with quiet breathing. And the expansion was normal for both with the deep breathing and the quiet breathing. I'll assess for tactile fragmentus now. We'll say 99.
99. 99. 99. 99.
And that was intact, the resonance. Let's see. Now I'll have you lean forward and arms folded in front of you. And I'll press. And that was normal. There's dullness was noted. And I'll take a listen to her breath sounds. Going from side to side. Deep breath. Deep breath. Deep breath. Again. Again. She had clear breath sounds bilaterally. There was no wheezing, rhonchi, or forced breath sounds. And her respirations are equal, and she shows no signs of struggling with shortness of breath. Now I'll come to the anterior chest. And again, her skin, there's no cyanosis. I don't feel any heaves or lifts. Her skin is warm, it's pink, it's dry. She has little respiratory effort with sitting here. And now I'll be, do you have any tenderness in any of the areas on your chest?
Nope.
All right. Now I'll be listening to her breast. Well, first I will percuss and then I'll auscultate. We'll first say 99.
99. 99. 99.
Her tactile fragmentus was normal. And now I'll percuss. Alright. And percussion was dull. And now I'll take a listen to her heart sounds. And the aortic, the pulmonic, the Erb's point, tricuspid, and the mitral. Okay. She had normal heart sounds of S1, S2, and I'll be assessing, auscultating her breath sounds. Okay, and she had normal breath sounds as well. And actually, to go back to her backside, I'm going to do the diaphragmatic expansion. So I'll have you lean forward. And I'll note where the dullness changes, which is right there. And I'm going to take a deep breath. Again. And it changes there. So 3 centimeters, which is normal. Alright. While she's sitting here, I'll assess her lower extremities, which there's no cyanosis. Her legs are warm and pink and dry. And when I'll have her lay down to assess her pedal pulses and her reflexes. Her pedal pulses are equal and 2+. Her post-tibial are equal and 2+ as well. More equal and 2+ as well. Here's mine. So I'll check her reflexes now. And then bend your knee a little bit. And again. Alright, and those are normal. So I'm going to test for her sensation. Close your eyes. And tell me when you feel this and if it's hard or soft.
Soft. Hard. Soft. Soft. Hard.
Alright. And that was normal. And also her hair distribution on her legs is normal as well. And do you have any pain in your lower extremities?
Nope.
None? Okay. And she walked in here with a steady gait and no signs of limping. Alright. And now I'm going to assess for her abdomen. Alright, let's see. So upon inspection, her umbilicus is in center. It's in the appropriate spot. Her abdomen is symmetric. It's flat. It rises and falls as it's with breathing. And first, I'm going to auscultate her the 4 different quadrants, starting with the right side. Her bowel sounds are present. I were to listen to each quadrant for a minute. Now I'll assess for her her arteries. So the first one is the abdominal aorta. Her renal. Her femoral. So her arteries had appropriate blood flow, no breweries or abnormal sounds or irregular sounds were heard. And also with her abdomen, there's no lesions, obvious masses, or discoloration. And now I'll assess with light palpation. And tell me if this hurts at all.
No. No. No.
Again, I didn't know any masses or abnormalities. And now I'll assess for deep. You feel her liver. Now feel for her kidneys. So feel both of them. And let's see, and now percuss. Which, all of her quadrants are dull sounding. Okay. You can slide your shirt right down. And you can sit up. Alright, and as for the cranial nerves, I won't be able to do cranial nerve 1 today. That would be testing for olfactory for smell. Optic nerve, which we already did for visual acuity and fields. Ocular motor, we assess for 6 corneal fields of gaze. The trochlear cranial nerve 4 is assessing her eyelids for drooping, which we did that upon the eye assessment, and there's no drooping noted. The abducens nerve, we checked her pupils, and they were equal, round, and reactive. For cranial nerve 6, which is a trigeminal, she didn't have any jaw atrophy. I had palpated her TMJ when she clenched. She didn't have any pain. Cranial nerve 7 is the facial, and her facial features are symmetric. For acoustic, we did the bone and ear conduction, and she was appropriate for that. The acoustic is for hearing, I already went over that. The glossopharyngeal is for taste, which we will not be doing that. We could do that in the clinic, however. For the vagus, we tested the uvula for symmetry and the gag reflex, and her gag reflex was intact. And her speech is clear, there's no hoarseness. The spinal accessory, which is cranial nerve 11, her shape and strength of her shoulders, what's the trapezius muscles, they're intact as well. The hypoglossal, which is the cranial nerve 12, is assessing her tongue at rest. There's no protruding. It's symmetric. There's no tremors or atrophy. So that concludes our assessment for today. Thank you.